In this presentation, I will talk about the etiology of the periodontal disease. I put these two pictures of these two great men in the field of periodontology, which are Dr. Fermin A. Cairns and Dr. Michael G. Newman, because they have given so much to the periodontal field. And as a simple acknowledgement from me for them, I put their pictures as a front page for this presentation, which will be the first presentation uh, in the periodontology series. The periodontal disease occurs in a pathogenesis that depends on three factors, which are the presence of a periodontium. The periodontium is composed from the gingiva, the periodontal ligaments, the bone, and the cementum, plus the presence of an irritating factor, plus the presence of an immune response. Guys, you should know that the immune response does not always benefit the human and prevent the periodontal disease, because as you know that there are some kind of lysozymes that will not only digest the bacteria, but they will digest the periodontal tissues in their way too. Okay, so that the abnormal or excessive immune response will destroy the periodontal tissue and will lead to a periodontal disease too. Okay, so that uh, if we want to have a periodontal disease, we should have a periodontium, an irritating factor, and an immune response to that factor. This is how a periodontal disease happens, and the irritating factors are either external or internal. The internal factors are divided into two types, which are local factors that are always present in the mouth as a permanent habitant, and the systemic factors that are present in the whole body, but their effect reaches the periodontium, increasing or decreasing the periodontal disease. And in this presentation, I will talk about only the local internal factors that are present in the mouth, which are the dental plaque. Guys, the dental plaque is the most important factor, local factor that will lead to a periodontal disease, because it is mainly composed of bacteria, of so many types of bacteria that will uh, hinder the periodontal health and lead to a periodontal disease. Okay, and also not only the dental plaque as a local factor that will lead to a periodontal disease, but the things or factors that will enhance its accumulation and retention will also lead to a periodontal disease. These factors are: number one, the salivary flushing and salivary proteins, viscosity and amount. These factors will affect the amount of the dental plaque present in the mouth and subsequently the periodontal disease. The diet, specifically the fibrous diet. The fibrous diet will enhance the salivary flushing and will decrease the amount of bacterial plaque and their bacteria and their toxins and their byproducts, leading to a decreased amount of a periodontal disease occurrence. Also, the correct techniques and frequency of the oral hygiene measures are very, very important factor to prevent the periodontal disease. Uh, Whether it is the toothbrushing procedure or the flossing procedure or the toothpicking procedure, whatever the oral hygiene measure that the patient will do, this will directly and most importantly affect the periodontal health and prevent the periodontal disease. And of course, the dental visits. How many times he visits the dentist annually? That will also affect his dental plaque accumulation and retention, and subsequently his periodontal health. The dental calculus, which is the calcified form of the dental plaque. Guys, when the phosphorus and calcium principally accumulate in the dental plaque, besides the other minerals like the sodium, potassium, and other minerals from the saliva and from the curvature fluids, will lead to the calcification of the dental plaque and the formation of this yellow material, as you can see here in this picture, surrounding the cervical parts of the mandibular centrals. This material is called as a dental calculus, and it will lead, of course, to the accumulation and retention of the dental plaque, hindering the proper doing of the oral hygiene measures and subsequently leading to a periodontal disease. The materia alba. The materia alba is that white, cheesy material that is present in the bottom of this picture, adjacent to the marginal gingiva. That is the materia alba. And on the other hand, that U-shape, yellow, resilient material is the dental plaque. Okay, so that, guys, I want you to distinguish the difference between the materia alba, which is that white cheesy material that can be easily removed by a water flush, and it contains less amount of bacteria than the dental plaque. And on the other hand, I want you to know that this U-shaped yellow to grayish resilient material that is present on the borders of the tooth is the dental plaque. Because it is resilient, it cannot be removed by a flush of water, and it contains much more amount of bacteria than the materia alba. And of course, both of them will lead to a periodontal disease. Also, the malocclusion. Malocclusion, when, for example, we have crowding. The crowding will, of course, lead to plaque accumulation and retention and periodontal disease. And also, not only the crowding. For example, if we have a premature contact or any type of malocclusion that will lead to a trauma from occlusion, trauma to the periodontium from the malocclusion, that will lead to a periodontal disease and periodontitis too. So that we should correct these things to prevent a periodontal disease occurrence. The orthodontics and the orthodontic appliances will lead to the accumulation and retention of the dental plaque, as we can see here in this picture, and also not only the appliances but the forces that we apply. If they are not very well and organized correctly and calculated correctly, there will be a hindering in the periodontal health and specifically the bone that surrounds the tooth. The removal partial dentures and any appliance or thing that we put in our mouth will lead to the retention and accumulation of the dental plaque and subsequently to a periodontal disease. These appliances will not only do this, but they will also lead to tooth mobility, and of course that is an enhancing factor for the periodontal disease occurrence and hindering for the periodontal health. And also the faulty restorations. The faulty restorations, guys, you don't know how many cases come to my clinic with overhangs and with a periodontal disease related to these overhangs, because the overhangs will simply lead to plaque accumulation and food accumulation and subsequently clinical attachment loss which is presented clinically as a periodontal pocket or a periodontal disease. So that this is very common. Also, from the fault restoration conditions are the rough surfaces, the open contacts that will lead to food accumulation and plaque accumulation and a periodontal disease, and of course the over contoured restorations, as I have mentioned in the principles of tooth preparation. You should never do an over contoured restoration to make it a thick restoration and durable restoration, and to conserve the tooth structure on the other hand. No, that is not correct. You should conserve the tooth structure to respect the biological considerations, but you should not over contour the restoration to respect the aesthetic considerations. No, that is not correct, because that will lead to the presence of an undercut beneath that over contouring and will lead to a plaque accumulation and retention and a periodontal disease, specifically in the bifurcation areas. And of course the subgingival margins that will be very close to the biological width and junctional epithelium. Guys, the biological width, which is composed from the junctional epithelium and the connective tissue beneath it, is the thing that will prevent the bacteria from going from the mouth to the periodontium, so that it should be respected, and we should not impinge on it to prevent the occurrence of the periodontal disease. This is very important during the preparations, specifically the crown preparations and these prosthodontic stuff. Finally, the modularies. The modular, whether they are present in your lips or on your tongue, they will lead to a plaque accumulation and retention, and subsequently to a periodontal disease. Specifically, the jewelries that are present in your lower lip, close to the labial frenum, they will lead to a recession in that area, and they will lead to pockets in that area for the lower centrals specifically. Thank you for improving yourself by listening to this presentation. Always try to know, spread knowledge, and construct the world. Be kind to others, and that is for the greatest benefit to the humankind.